What are the causes of radicular lower back pain? Now, again, I'm speaking about folks in the gym. I'm not talking about the average person who doesn't work out whatsoever, right? I'm talking about folks that like to lift heavy weights. Okay. And here's what I will say: injury onset is complex and multifactorial, right? So there are a lot of reasons why you can hurt your lower back. And what I'm doing is I'm extrapolating this from other sports injury research. You're not going to see a million research studies that are all specific to people that like to weight train in the gym, right? You're going to see a lot of studies that are based on other types of athletes, and I'm going to be drawing information from them, right? Um, so one possible way that you can get low back pain is by introducing a weightlifting program or any other intense lower body training program too quickly, right? So basically, if you're not prepared for a given program and you jump straight into it, you're more likely to get hurt, right? So let's say you're trying a small off squat cycle or something along those lines. You're used to squatting once a week, and all of a sudden you're squatting 4 or 5 times a week. You're a little bit more likely to get hurt just because your body's not prepared for that program, right? Same thing goes for being a novice trainee. So if you've been training for less than 6 months to about a year, right, based on the research that I'm citing here, and again, you can check that out. It's going to be in the show notes. You're more likely to get an injury, and it's just because your body's not really prepared for that stress yet. It takes a long time to build that tolerance, right? Nothing that can create some pain and problems is a lack of consistency with training. So let's say you train 3 to 4 times a week for a few weeks, and all of a sudden you get pretty busy and you're only able to train 1 or 2 times a week for a few weeks. And then you go back to the gym and you're trying to make up for that loss of time. So you start doing 4 to 5 days per week worth of training. All of a sudden you get hurt just because you had a period of time where you deloaded, right? Deconditioned your body. And then you try to ramp back up again all of a sudden and you get hurt, right? The last one is just excessive training volume. So a lot of folks want to try whatever hot new program out there to improve their deadlift or their squat, and it might just be too much total volume and or intensity for the body to handle, right? And because of that, you can get hurt. Okay. Um, Another anecdote I want to say, and we'll get to this in a minute, is that most folks believe that technique is the main driver behind low back pain, right? Especially radicular low back pain. And we're not going to go too deep into technique as it relates to low back pain because that's a huge ball of wax. But you may have some technical issues that could be leading to someone's pain. But just going through these 4 factors here, you can obviously see that there's a lot of reasons why you can potentially get hurt. And it's not as easy as my technique was off and that's why I got hurt, right? So classically, from Stu McGill's research, where he was bending pig spines, what they found is that if you combine flexion and compression in a pig spine for thousands of repetitions, you create more disc pathology by combining compression with flexion, as opposed to just compressing a pig spine. And this is where, and there's a lot of hubbub around this whole thing, but basically the whole idea of flexion and compression causing disc pathology, disc issues, and potentially radicular issues. A lot of that came from Stuart McGill's original research, right? And I think it's important to understand the study was basically taking pig spines and either compressing them or compressing and flexing them, right? And the ones where you compress and flex, they had slightly more injury, right? However, the ones that just got compressed got injury as well. But when people talk about not rounding your lower back when you deadlift or squat, this is the reason why, for the most part, right? There's other research studies that try to look at this as well, but this is a major reason why people believe discs get herniated in the bottom of a squat or deadlift because we don't have good technique. We're not keeping a neutral spine. Topic for another day. All right. I think it's way more complex than just that, but that is a potential reason why people get some disc issues within their spine. Okay. Another thing that can lead to injuries are spikes in training volumes, right? So think about, let's say New Year's just crossed a couple weeks ago. A lot of folks aren't used to exercising very frequently, and all of a sudden their New Year's resolutions are to go to the gym 5 days a week. They start going 5 days a week. Good for you. I think that's a great thing. However, you just spiked your training volume. You're now training way more than you normally do, and you're a little more likely to get hurt because of that, right? What else can be related to lower back pain? A lack of coaching, or having poor coach/athlete relationships. So lack of coaching makes total sense, right? So if you don't have someone telling you the sets and the reps, when to do this exercise, when to do that exercise, how to program over the course of time, not giving you any feedback on how to do the lifts appropriately, you're a little more likely to get hurt, right? And the other piece is that if you don't have a good relationship with your coach, so I know most folks in the gym don't have a coach, but if you do, you don't talk about your injuries and talk about what's giving you issue, right? Your coach is not very likely to try to modify things so you don't hurt yourself further over the course of time. Another thing that has a pretty good correlation to injury is going to be recovery, right? So if you don't do a good job of your nutrition, you don't do a good job of sleeping enough at night, if you're really bad at managing stress or you don't have enough recovery days between sessions, that might cause a low back issue as well. The other thing that can, create some issues is going to be not taking prior lower back injuries into account, right? And I really, really like this book. It's called The Body Keeps the Score. It was authored by a guy by the name of Bessel van der Kolk. I'm sorry, Bessel van der Kolk. I always botch the name. I apologize. It's actually a book on PTSD. All right. So not the most relevant to orthopedic injuries in the gym, but the theme of that book is the body remembers old injuries, right? So if you have a deadlift injury from 5 years ago, your body remembers that old injury and it's a little bit more apt to create pain again in the future just to protect you because your body doesn't want to repeat the past mistakes, right? So if you have a prior injury, right, especially low back pain, we know that tends to recur over the course of time, you're a little more likely to experience more pain in the future, right? The other thing that can cause radicular low back pain is going to be a particular psychological profile or characteristics. And these profiles are going to reflect your choices of what you end up doing in the gym in terms of how much weight you use, how likely you are to push through pain, those types of things. And one big one that does correlate with injury is going to be the high athletic identity, right? So if you identify as a super strong person, super fit person, you think your sense of worth is all wrapped up in your ability to be a strong person, right? A very fit person, then you're likely to push through pain if you have an injury, just because an injury is going to be a major threat to your sense of self. If the reason why you think you're a good person in this world and have value as an individual is because you have a big deadlift, right? If you have low back pain, that is a major threat to your sense of self, right? So you're probably likely to deny that pain and just continue pushing forward because you don't want to have an injury to eat away at your sense of self, right? Or to have some sort of knock on your sense of self. The other psychological characteristic that does correlate with injury is perfectionism. And I think the thought here is that if you're a perfectionist, you just feel like you always have to do what's written on the program for that day. And you want to be perfect about your training. You want to try to do as well as you possibly can, because being a perfectionist has a lot of pros, right? If you do everything extremely well, then that's going to work out pretty good for you in life in general, not just with training, but it's going to allow you to make better progress over the course of time, obviously. But it also is a bit of a double-edged sword, because if you're a perfectionist and your body is not feeling good and you really want to get through that workout and kind of hit those numbers you're supposed to hit for that day, you're a little more apt to push through that pain because you want to have a perfect day, right? Perfect training, right? And the last one is working through a less severe injury. And this one's actually pretty cool. And you can check out the citation again in the show notes, but I'm thinking about a study in soccer players. And what they were showing is that if you had an injury that wasn't that bad, so it wasn't causing you to stop training at all, right? So you can still train through this injury, called a non-time loss injury. If you train through a non-time loss injury, you're much more likely to get a more severe injury. And that could be in the same area where pain is currently. So let's say that you tweak your hamstring, right? And keep training, that could turn into a more severe hamstring injury. However, it can also turn into a more severe injury somewhere else. Okay. So if you're working through injuries, there's a good chance it's going to get worse over the course of time. So if you are loving what you are learning right now, I highly recommend you check out my fitness pain-free episode where we go over a patellar and quadriceps tendinopathy guide. I will leave a link in the show notes. Definitely recommend checking it out. You can also click on the link right above if you're watching this on YouTube and get started watching right away.